Hi again, everyone. Carla Macias here, and welcome back for another episode of Best Docs Network featuring Forest Park Medical Center. Our show is bringing you some of the best doctors in the entire Austin area who are really changing people's lives. Now up first on our show, we're going to hear from bariatric surgeon Dr. Michael Lee and how he helped his patient Alexandria to a new journey of weight loss. Let's take a look.
I like the fact that he does my learning style because then I can know exactly what's going on.
Laughing not only eases stress, it promotes social bonding and lowers blood pressure. It may also boost your immune system, so bring some humor into your life.
experiences for people.
Best Docs Network, helping people find the right doctor at the right hospital. Best Docs Network, featuring Forest Park Medical Center. Here's a fact about Forest Park Medical Center. The Dallas campus was one of the first hospitals in all of Dallas to use the Makoplasty robotic arm for hip replacements and partial knee resurfacing. Now let's hear more about this device from a couple of orthopedic surgeons and the benefits utilizing Makoplasty for hip and knee replacements.
The Makoplasty is a robotic adjunct for joint replacement. It's good for inside of the knee, the outside of the knee, or combined inside and what's called patellofemoral or underneath the kneecap arthritis.
It's relatively advanced technology that helps increase the precision of the surgeries that we do. A lot of the orthopedic surgeries in the joint replacement field have a lot to do with measurements and alignments, amounts of cartilage and bone that we remove in order to replace either that exact amount or some variation.
The ideal candidate for Makoplasty is anyone who has usually mild to moderate arthritis that's confined to one. There's basically three compartments in the knee: the medial or inside compartment, the lateral or outside compartment, and the anterior compartment, which consists of a groove called the trochlea and the patella.
So having technology in this situation with Mako using the robot, which helps you to execute the plan that you have preoperatively to achieve a certain result. The robot is actually helping you during surgery. But a big part of the technology is the information that we get from the computer system with the preoperative study to help plan the surgery before we ever make an incision.
How Mako is different from the standard partial knee replacement is the excellent reproducibility of putting in the implant. One of the more difficult things about doing partial knee replacements is getting the implant in a good position and maintaining the soft tissue structures. The way the Mako system works with the CT, we do a CT scan and it tells us we can set exactly where we want our resection level to be, the exact angle of the implant, and it's 100% reproducible from our plan based on the CT scan. It's impossible to have that done any other way than with the robotic surgery. It will literally stop you from making a mistake.
Overall, Makoplasty knees are a significant improvement on a partial knee replacement that we've done for many years, and because it's done better and more precisely, it allows us to open up to a larger potential group of patients and get better short-term and long-term results.
It's literally the minimum of minimally invasive surgery for knee replacement.
Dr. Ned Snyder is a plastic surgeon and reconstructive specialist here in the Austin area. Now let's hear his methods on practicing medicine.
From the time that a patient becomes engaged with our office until the completion of their breast reconstruction, when in many cases that can be complicated. We may see somebody at the very beginning of a cancer diagnosis, and we may not finish them until after they've had what can turn into a lengthy process of treatment. And we're with them the entire time. I think that we play an important role in their cancer treatment. And I think we take a lot of pride in that, and the sort of customer satisfaction end of it, or customer service end of that, but also in outcomes. And that I think that we have exceptional outcomes, and I think that our patients are extremely happy with the product. So I think it's important, and I tell this to all patients, that I'm going to stick with them all the way through. And then some patients come to us with complicated problems that they're not as straightforward as a new cancer diagnosis and a reconstruction at that time. They may have had failed reconstructions from other places, and I'm going to stick with them until they're done, and I promise them that from the start. So I think that that's an important tenet of kind of what we represent, or what we do here.
Forest Park Medical Center is a different kind of hospital, designed for warmth, designed for comfort. Forest Park Medical Center is your destination to better health.
What's the right amount of sleep? There's all kinds of nebulous terms like circadian rhythm, and what's all that stuff mean? Well, overall, the goal for your amount of sleep is about 6 to 8 hours a night. Seems to be plenty. You'll hear rumors that, well, you're supposed to sleep less as you get older and so forth. That's not actually the case. What often happens in older folks is that there are medical reasons for you to be awakened in the middle of the night, or emotional things or whatever else. But the overall goal is still 6 to 8 hours of sleep every night consistently, with the time you go to sleep ideally about the same time every night, and the time you awaken about the same time every night, within reason. Well, the first mistake a lot of people make with sleep is that they tend to do things in bed, like watch TV, play on the iPad, which is auditory and visual stimulus, which tends to keep you awake. So when folks tell me they have a hard time sleeping, that's the first thing I'll ask them is, well, what are you doing in bed? Because the bed is meant primarily for sleep. It's not meant for electronic devices. And that one little change can actually make a big difference in your sleep pattern.
I really like it here at Forest Park. It's fantastic. All the administration, they come down and they come talk to me. It's just a wonderful, wonderful place to work. Work is fun, and that's what you want in a job. You don't want it to feel like work, you want it to feel like fun, and that's what Forest Park does. Forest Park makes work fun for me. It's not just about the job, it's about the people, and the people here are great. You can have the best job ever with the best benefits, but if you don't like who you're working with, then you're not going to enjoy work. But Forest Park has fantastic people working here, and seriously, I love coming to work at Forest Park. It's a great place to work.
If you're looking for more information on any of the doctors you've seen so far on our show, head to our website, bestdocsnetwork.com. You can do this by clicking on Austin underneath the Our Doctors tab. Once on the Austin page, you can browse through all the different doctors by specialty or location. One of those doctors you can find on our website is Pediatrician Dr. Ray Esparza.
Kennedy, she was less than a month old when she got her first ear infection. And then it was continual after that, monthly, every couple weeks. Kennedy was unable to speak for about the first 2 years of her life, and we determined then that it was the ear infections and all the scar tissue on her ears that was keeping her speech delayed.
The ear infections affected my life most of because I couldn't hear my parents or the teachers. I couldn't listen to music, watch TV because I had to turn up really loud.
The treatments for the ear infections were typically at that time oral antibiotics and then some prescription ear drops. After a certain point, Dr. Esparza would recommend going to a specialist for her ears.
This is the way your ear looks on the outside, and this is the way your ear looks on the inside. A middle ear infection is a collection of pus right in this area. When you get this pus here, it makes this eardrum come out. As it comes out, that is what gives you ear pain. An outer ear infection, or more commonly known as a swimmer's ear, is when water gets into your ear canal, stays here, and develops an infection on the skin of the ear canal. One of the key features of this particular ear infection is pain when you pull on the earlobe. Ear tubes are used for middle ear infections and not outer ear infections.
Since the last set of tubes, Kennedy has not had to do ear drops. She has not had any other ear infections, and everything seems to be normal.
Today I feel really good. I feel proud of myself. I can hear better. Dr. Esparza is really helpful. He just welcomes you into his office. He makes you feel comfortable. He's really honest with you. He doesn't hold anything back. He's just a really great doctor to have. I really recommend him.
It is very important to find a pediatrician that you're comfortable with and that understands your family. Thankfully, we found Dr. Esparza.
So why did I join Forest Park? Well, this is an opportunity for me to be a part of the best hospital that's going to be in Austin. This is going to be a conglomeration of the best physicians and the best surgeons in the entire city, all coming together to make the most efficient, cost-effective place for functioning in the entire city of Austin. I'm excited to be a part of it. I'm equally or more excited about this for all of the patients that are going to have the best medical experience that they've ever had in this city.
Austin is pretty much dominated by the very large hospitals that pretty much serve the community, not by smaller hospitals that are private. Well, I think that there's a lot of individuals who are private individuals who may need surgery that could really benefit from a physician-owned, physician-run hospital that's going to cater to good service, good outcomes, good surgery. So to be part of that as an investor, I was excited about that, and to be involved with the doctors who will be doing surgery there. And as a primary care physician, I'll be involved in my referrals to the doctors who are doing surgery, so that there is a continuity of care between the surgeons and the primary care doctors, and knowing that the patient is going to get very good medical care.
We're very excited about Forest Park Medical Center coming to our area because we understand that there's a very high caliber physician that practices at these centers. They've had a lot of success in the Dallas-Fort Worth area. I think we're fortunate to have a facility of that level here in Austin Round Rock.
A physician-owned hospital means that we can give you the care that you need without having the bureaucracy. We don't have a person in charge who isn't involved in medicine, somebody who's telling us that we have to do something because it's a rule of the hospital. We can make medical decisions because that's what's best for you, not because it's the rule of the hospital. And the people that are involved in this project are just phenomenal. It's going to be an amazing project.
In 2010, Haiti suffered a big earthquake. I think it was 7.0 on the Richter scale. And it was devastating for a couple of reasons. It's the poorest nation in the Western Hemisphere, and the infrastructure is really poor. The buildings don't have codes for earthquakes or anything like that. So when the earthquake hit, I mean, everything just fell apart. And then being economically poor, they really don't have the infrastructure to respond to any kind of emergency like that. They don't have ambulances and fire trucks. They don't have construction equipment all over the place. So it was very difficult for them to respond to that. So one of the first responders, if you will, to the situation was a medical team from Forest Park Medical Center. They went down to provide medical assistance in evacuating people, triaging people, and of course providing treatment, bringing doctors and nurses and supplies and equipment. That, in conjunction with one of the charities down there, turned into a regular visit, where with Sacré-Cœur, which is the hospital down there, we would send a team and participate in surgeries on a regular basis. They would get patients that needed surgery ready. When the team arrived, they'd spend a week basically operating day and night to treat the cases that otherwise would have been too complex to treat in Haiti. So in the United States, we have a very robust system. It's very refined. There's safety protocols everywhere. Everything's disposable, so nothing gets reused. But in Haiti, it's the polar opposite. You're operating in a hospital that's an open-air hospital. There's no air conditioning. The one air conditioner that is in the hospital is in the operative suite because under gowns and stuff it gets very hot. But it's a window air conditioner. The air's not filled. The instrumentation is very basic from the 1960s. Everything that they have is something that's been designated from a first world country. Well, this is a great opportunity to do what doctors really want to do. I mean, this is why you become a physician, because you have this overwhelming compassion. Anytime you see somebody that is hurting or is sick or is in pain, you want to help them, no matter what it takes. I mean, sometimes it becomes a downfall, but in this situation, you're able to go to a country and really give them something that they really never had access to. And in 100 years, they probably wouldn't get to it because it's such an economically poor country. I mean, when you go there, you see it's open sewer systems, the water they get out of the mountainside basically running down, and who knows whether it's clean or not. Again, the infrastructure is terrible. The buildings are half completed. There's no disposal system. Trash is everywhere, and it may not have been like that before the earthquake, but certainly it is now. They have basically paralyzed all the infrastructure to the entire country. We're able to go in there and just help with those situations, using the expertise that we have. Well, Forest Park has really been, I think, a leader in helping out. When this disaster occurred, of course, there were other hospitals that sent back teams, and there are other hospitals around the United States that sends teams as well. But in the Metroplex, Forest Park has been the one that's routinely gone back to help out, to bring supplies, to lean on our vendors who have been very helpful in when we upgrade our equipment, for instance, we can take that and use that for the Haiti missions. It's shown a remarkable sense of leadership and a remarkable sense of the responsibility that it is to be in the healthcare field for Forest Park to go down there and participate the way they have, not just initially, but on a regular basis.
If you're looking for exclusive VIP medical treatment, then you're going to want to stay tuned and listen to our next doctor, internal medicine specialist, Dr. Terry Chambliss. Dr. Chambliss will be explaining diagnosing prostate cancer with one of his patients. Let's take a look.
I feel great today. I mean, I'm healthier than I've ever been, and stronger and thinner, and so I feel really good. But if it wasn't for Dr. Chambliss, I wouldn't be here, probably.
And Steve's quality of life has improved. He feels maybe 15, 20 years younger than he has, and he's going to do very, very well for a very long time.
Dr. Chambliss has always been right up front with whatever is going on. If he can't take care of it, he always has a specialist that he recommends, several of them, but usually the one he recommends I go to, and they've always been good, and it's always taking care of the problem. I think if I had a doctor to choose again, I would choose Dr. Chambliss, and we've just been a great relationship for 20 years now, so he keeps me patched together.
Greg has a question for Dr. Loren Jones. Should I be worried that my BHP or enlarged prostate could be related to prostate cancer?
BPH and prostate cancer are not related. That said, they can happen in the same patients. I would recommend that any man with BPH symptoms be screened for prostate cancer as part of his workup.
Select Art I started about 28 years ago. It's a private gallery, and I specialize in providing art for public spaces, and primarily doing hospitals and MOBs. And over the 28 years, I've probably installed over 100,000 pieces of art. This is my love and passion in life. My overall goal for Forest Park is to make each space unique and come up with new art concepts for each facility. So what I do is generally I start several months ahead of time once I know a facility is coming about. The art should support the design of a space, very similar to if a man buys a nice suit, then his shirt and tie should support his suit, and a lady's handbag, jewelry, and shoes should support the dress that she selects. So art's kind of like that. It really needs to coordinate and support the design of the space, yet each piece is an individual piece of art. What we're putting together for Austin is two large freestanding sculptural pieces. We're doing a number of pieces, custom pieces on plexiglass. We're doing a number of pieces on metal. We're doing a number of pieces on canvas, and then we're doing a number of three-dimensional pieces that project from the wall in glass and different fabrications like that. It's exciting for all of us to put a great art program together. And, you know, and the day of the installation is when it all comes together. And so we get it all there and we get it placed and installed, and then it's like magic. Everything all comes together and it's like, wow, this is great, you know? And people are excited and they're lit up, and we get compliments, you know, the day we install it from the employees that are around, and, you know, it's a win for everybody. So, yeah, we all just keep moving forward.
Lodging provided by Radisson Hotel and Suites. If you didn't find the right doctor on today's show, no worries, because you can head to our website, bestdocsnetwork.com, and browse through all the different specialties a part of our network. If you got any questions or comments or want to tell us a great story of your doctor, send us an email at info@bestdocsnetwork.com. So long, everyone, and we'll see you next week.